Please bear with me for just a second. Good morning, everyone. Thanks so much for carving time out to join us this morning. I know it's a busy morning, but I appreciate you being here. We are joined this morning by Greg Jackson with Life Sciences Greenhouse Investments. It's a mouthful. So thanks to Greg for taking time out. I'm Alexis Gossick with the Technology Council of Central PA, and I appreciate you being here. Since we have a short session this morning, we are going to go ahead and get started pretty directly so that we don't take up too much of Greg's time. So Greg, I'm going to go ahead and turn it over to you to get us kicked off this morning.
Thank you. So my name is Greg Jackson, and I'm the Executive Vice President with Life Science Greenhouse Investments, formerly known as Life Science Greenhouse of Central Pennsylvania. The Life Science Greenhouse of Central Pennsylvania was founded 22 years ago with tobacco settlement money. Pennsylvania dedicated a portion of the tobacco settlement money to promote human health. And one way they did that is they funded 3 greenhouses, one in Philadelphia, one in Harrisburg, and the third in Pittsburgh. And we are a nonprofit evergreen venture capital firm, which means that we took our original appropriation and invested wisely. And then the proceeds from our investments, we can reinvest in companies. We only invest in Pennsylvania-based companies in the life sciences, broadly defined. So therapeutic companies, pharmaceutical companies, medical device companies. We have some healthcare IT companies, and I'll talk a little bit more about those in a minute. My personal background was I was trained as a scientist. I spent 15 years in academic medical research in eye care, ophthalmology. I worked at University of Alabama at Birmingham and Penn State College of Medicine, where I investigated eye diseases such as age-related macular degeneration, which is the leading cause of blindness, irreversible blindness amongst older adults, and diabetic retinopathy. I had several inventions in my academic research career, so I went on an 18-year journey as an entrepreneur, started a medical device diagnostic company in the ophthalmic space, started with 3 guys in a garage, worked up to 125 people, exited that company a couple years ago. At the time that I exited the company, I was looking for another opportunity, and Life Science Greenhouse was the first professional investor in my company. And my longstanding board member, Ron Thibodeau, retired, and I assumed his place at the greenhouse. So I'm largely responsible for deal flow, trying to find companies to invest in, as well as conducting due diligence on those companies, and I serve as a board member for several of our portfolio companies. Give you a flavor of the kind of investments that we make. One company is a company called Forma Medical right here in Harrisburg, Pennsylvania. They have developed a system, medical device system, to conduct minimally invasive surgery for hammer toe correction. As you know, hammer toe is a condition where people's toes can fold over so that they're not straight. It can be a very painful condition and is cosmetically unappealing, but largely it's a painful condition. It frequency increases with age. There's about 400,000 surgeries done per year, and they developed a system to make the surgery much more palatable to the doctor and the patient. The current standard of care is basically you fillet the person's toe, you cut off almost all the top skin, and you insert screws to straighten it out. It's a very painful, long procedure with a very long recovery, and you're left with very noticeable scarring, as a result of that surgery. This surgery, you create a 2-millimeter incision at the tip of the toe, and use fixation devices to very quickly insert screws, and you have a very minimal wound. People can resume normal activities much faster, and again, you have cosmetically improved outcomes. So relatively in some ways simple technology, but very powerful technology. On the opposite end of that spectrum, we've invested in a Pittsburgh-based company called Realize Intelligence. It's in the healthcare IT space. They've used artificial intelligence, large language models to disrupt clinical trial recruitment. Their software, their platform connects to standard electronic medical record systems and collects patient data in real time, particularly in the area of oncology. And they can instantly match cancer patients to available clinical trials that the organization's conducting. For example, they're integrated at UPMC, and whenever a patient has a new lab or a new note entered into their medical record system, that patient's data is refreshed within their platform, and the AI decides whether or not they meet inclusion and exclusion criteria for the cancer trials that UPMC is participating in. This is a huge productivity increaser because right now the current standard is that a highly trained human, reviews medical records and takes hours to do this, and now that's crushed to seconds. It's also helped with equity in terms of now UPMC can screen all their cancer patients, not just the cancer patients at their large facilities, but in their rural facilities, because it's all done by software and not humans. They have shown that they can increase their oncology trial enrollment because now they can screen way more patients across the Commonwealth and now offer these cutting-edge clinical trials to people in smaller towns that they would just not have been identified. And so, not only does this increase revenue for the provider because they can do more of these trials, which, are a good source of revenue, and help human health and patient outcomes by providing cutting-edge therapy to patients who otherwise wouldn't be included. So with that introduction, I'd be happy to answer any questions or discuss anything about the greenhouse.
Greg, I did have a question, and I don't want to monopolize the conversation, but what does the process look like as you are researching companies to invest in? Is that they come to you? Are you working and pitch their idea to you? Are you working behind the scenes and kind of keeping a pulse on what's going on and then reaching out and soliciting those companies and kind of interviewing them for those opportunities? How does that process work?
Yeah, thank you for the question. Yeah, it's a good question. So we, we receive applications through our website for funding, and we'll talk about the typical funding in a moment. But we also attend conferences. We also talk to other investors in the Commonwealth. So we are actively searching for companies as well. But they're always free to come and submit an application on our website. So I attend conferences throughout the Commonwealth. We sit in several meetings with large angel investor groups and look at their deal flow. So it's a very active process that we are searching for companies. Not that we know all the companies. Like, for instance, we're pretty well integrated into the Philadelphia ecosystem, and we're just now starting to integrate ourselves into the Pittsburgh ecosystem. So we're always looking for referrals and applications. So the process is generally someone would come to us or we would identify someone, and then we would have a conversation with them. It's very typical process for a venture capital firm. The CEO would meet with one of our members, one of our team members, and go through their pitch deck. We would then decide whether or not they would meet the criteria of a company that we would be interested in investing in. I'll put more color on that in a moment. And then, assuming that that looks good, we may do some pre-screening, review some materials and try to understand the opportunity better. Assuming the pre-screening goes well, then the CEO and their team would come pitch to us in either in person or in Zoom, depending on the locations of everybody, and we would do a formal pitch. Assuming the pitch goes well and there's an interest on both sides, we move forward into full due diligence. We would review corporate records. We would look at intellectual property. We would look at financial models, review corporate governance, and do the kind of analysis a typical venture capital firm would do to decide whether or not to make an investment. If we chose to make an investment, typically I like to say it this way: pre-COVID, our first investment's usually $250,000 to $500,000. Post-COVID, our initial investment has typically been $500,000 to $1 million on an initial investment. We try to participate in the subsequent funding rounds if the company is doing well. The form of the investment, most often, because we tend to invest in early stage companies, is most often takes the form of convertible debt. We will participate in safe notes. Generally, we don't lead safe notes. We, of course, would also participate in an equity round. I would say, 50 to 60% of the time, we're often the lead investor, which means that we would negotiate the terms of the investment with the company and then try to build a consortium of other investors. So we are required to do two things in particular. We're required to invest in companies that have a meaningful presence within Pennsylvania. So many companies are corporations that register in Delaware, incorporated in Delaware, but registered to do business in Pennsylvania and have like their corporate headquarters here. That's a very common type of company that we invest in. Also, we invest in life sciences broadly defined, but it has to be human health. We do not invest in animal health or ag tech. So I would also say, stage a company. So whether we're talking about a pharmaceutical company or a medical device company or, a healthcare IT company, generally what we like to invest in is companies that the basic science has been completed and successful. We tend not to invest in companies at such an early stage that the basic science is still in question. Those companies are often better off raising money from friends and family or using certain governmental grant programs that will help you do that translational research to show that the science is fundamentally correct. Ideally, we would like to invest in companies that either are, going to conduct their studies for regulatory approval, whether that's a 510(k) or whether it's a new drug application. So phase 1, phase 2, phase 3 clinical trials are the equivalent on the medical device side. We often invest in companies at that stage. We do have some companies that our first investment has been in companies for which they already have regulatory approval and are in the early stage of commercialization, that are raising $1 million to $5 million to grow sales. Any other questions?
I don't have any other questions, but if does anybody on the call, my brain is swirling, right? This has been extremely informative for me, learning a lot that I didn't know. Anybody else? Questions? Okay. Greg, did you have anything else that you wanted to share this morning, or do we want to encourage people to reach out to you directly if they have questions or are looking for additional information?
Yes, thanks. Yeah, obviously, if anyone that sees this would like to apply for funding, please either reach out to me directly. I know that my contact information will be shared with the participants, or go to our website and put in an application. We love to collaborate. Part of our mission is to promote the life sciences ecosystem in Pennsylvania. We do a lot of mentoring. We do a lot of early company advising. We're advising entrepreneurs that are not yet ready to apply for funding to make sure they're doing the things that will position them for funding, not only from us, but just from investors in general. So we love to have conversations about technology and life sciences. And we have access, on our team to a lot, decades of experience in pharmaceutical and medical device development. We have a very extensive network of advisors and people who like to mentor early stage companies, because there's a lot of things you can do very early on that are very good to position you for success with investors. And there's a lot of things you can do very poorly, and it's very important to integrate into this ecosystem. So we're happy to have casual conversations, informal conversations, and mentoring, and try to help the company get on the path to success with investors. So, I look forward to continuing the conversations. If anyone who watches this has friends that are starting companies, please, think of us, and when they start talking about needing to raise money, we're happy to have these conversations. Thank you.
Perfect. Thanks so much, Greg. And I really love that you kind of brought in the holistic piece, right? And maybe now isn't the exact time that companies are looking for investment, but being able to offer up that, let us help you at least set the path, right? And make sure that you're on the right path. Lots of times just saves so much time and effort and resources rather than heading down a path and it not being the most efficient one, right, to get to the destination. So thank you for that offer. And certainly TCCP will be spreading the word and pointing people in your direction if it seems like a good fit. As Greg mentioned, I will get a follow-up email out to everyone that registered to attend today's call with Greg's contact information, a link to the website, all of that good stuff. We're also recording today's session, so we'll make sure to post that on our website so that you can refer back to it or pass it along to anybody else that might have any interest. Aside from that, please feel encouraged to contact Greg directly if you have any questions. Otherwise, we'll wrap it up here, give you a couple minutes back, and I hope that everybody has a great rest of the day today. Thank you, Greg, for your time this morning. Appreciate you.
Thank you, Alexis. Appreciate it.